My name is Bill Carmichael. I was initially diagnosed in June of 2021 with rectal cancer stage 3C. I was 3C, which meant that the tumor started within my rectum. It moved all the way through the rectal wall, came to the outside of the rectum, and then started to impact the lymph nodes, the surrounding lymph nodes. So we had 6 months of chemotherapy. That was followed by a month of chemo and radiation. And then I got a little bit of a break, and then I had a lower anterior resection to remove the tumor from my rectum. And so during that time, they also removed a bunch of the abdominal lymph nodes, which even after chemo and radiation were still cancerous. And so we thought, kind of going into this, that this was going to be a 9-month trek, and I'm going to be back in business because it's 3C, which is that close to 4. But I had a really good outlook that I was gonna, we were gonna able to get this thing taken care of. And so I was given the option to either continue with what's called mop-up chemo or to do what's called watch and wait. And so I elected to do watch and wait because I had clean scans, everything was looking good. And then in July of 22, which is about a year after my initial diagnosis, I had lymph nodes pop positive up in my neck. And so at that point, I graduated to stage 4, and I've been on chemotherapy ever since. I did my 103rd treatment last week. When I look back at it, I had symptoms probably 15 months before I was diagnosed. So I first had symptoms, I would say probably February, March of 20. And what was going on in February and March of 20? COVID hit. My job at the time, I was an operations director at the hospital. I had a lot of departments under me, a lot of stress. I started to have blood in my stool, or when I was wiping it with figured, it's either stress or hemorrhoids. That's probably what this is. 6 months later, I was just having a little bit more difficult time, pooping. And so everything was really loose, and I was in the bathroom a lot. And so I thought, maybe I have celiac disease or I have some kind of irritable bowel syndrome or something like that. Eventually, my wife talked me into going in and getting, she's like, you're gonna be 50, so, schedule your colonoscopy. So I scheduled my colonoscopy in January. It took 6 months to get in because that's just the way it is sometimes. And so the last thing on my mind was cancer. So we get into the procedure, the doc goes in and he can't even pass the scope. So he ends up using a pediatric scope, and he could barely get that by. He took biopsies, we terminated the procedure, he came to talk to me and said, this is cancer. He goes, it's huge, it's a very, very big mass, and so we need to get on it. I was shocked, scared, and it was like, gosh, what am I gonna do? You have plans for your life, and and you work hard and you try to get to these places, and all of a sudden I was like, this is gone? I have cancer? What now? So, after I got all my scans and blood work done and all the other stuff, and we actually came up with the official diagnosis, it was like, all right, now, well, I can either fight this or, not. And I was like, well, I don't lose, so I'm gonna fight this thing. So I'll start chemo on a Monday where I'll get several infusions. I go home on a pump and I wear that pump for 2 days. And then I'll go back to the cancer center to have that removed, get a few more infusions. I'm kind of feeling crummy for 3 to 4 days. I liken it to like a chemical concussion every other week. Fluoride, that's my primary chemo, which goes in and it destroys the cells. But what it doesn't do is it doesn't cure. Once the cancer is seeded, it's very difficult to get rid of. So it'll kill the cells that grow. And then the other drug, which is called Vectibix, that is the drug that binds to the cancer cell and it doesn't allow the cell to replicate. So it's kind of like a 1-2 punch with these 2 meds. And what that's been able to do is keep my CTs and my PET scans clean. But I still have the cancer in there. This is the frustrating part with chemo and patients sometimes, is that you're on this schedule of chemo because it destroyed my career. I couldn't work anymore after a couple of years. It was just got too difficult to do. But I still have to keep doing it. but my scans are clear. So you get frustrated with that. You know, everything that else that's going on with your life has to change because of these side effects and the way this treatment makes you feel. And so you begin to question, well, do I really need to do this? And a lot of people will stop, and 3-4 months later, it'll pop up somewhere else. And then it's more difficult to get rid of. What's been told to me by my physicians is that in our experience, you're gonna need to do this for the rest of your life until there's a cure. Every treatment at some point becomes ineffective and it stops working and you have to move to something else. The good thing is that this was, when I started this in 21, this particular regimen that I'm on now was pretty much last ditch. And now there's 2 other pathways that I can jump into. I've been on chemo for pretty much 4.5 years now.